The emphasis on opioid overdose deaths has sort of fallen out of the news spotlight lately, but it has not gone away.
Listen to these numbers. Nearly 82,000 people nationwide died from an opioid overdose in 2022. More than 645,000 have died in the U.S. since the epidemic began. Now, let's talk about Somerset County, Maryland, which accounts for 4% of the Maryland population. According to StopOverdoseMaryland.gov, from 2017 to 2020, opioid overdose deaths in Somerset County increased 200%. 200%, Jimmy.
200%. Okay, so perhaps you're asking yourself, isn't there something we can do to fight this? Good news, the answer is yes. With us this afternoon from the Somerset County Health Department, two people doing everything they can. Yvonne Harris is the local Behavioral Health Authority supervisor. Tony Jones over there is a certified peer support specialist. Guys, thank you so much.
Thank you
for stopping by to talk to us. So let me ask you this. We're talking about two things specifically. One of them is the no-cost harm reduction vending machine.
Yes.
Tell us what this thing is.
It's a vending machine that has products in it that help with individuals who are using drugs, and they need anything from bath stuff to Narcan to fentanyl strips. I have some samples here. We have the Terra bags, small and large. So what they do is, if anyone has medication,
right,
and they want to dispose of it, instead of throwing it in the trash or flushing it, they put their medication inside the bag, put warm water inside of it, shake it up, wait for a few minutes, and then you can seal it and dispose of it.
Never even heard of it.
No, me neither.
Then you could just throw it in the trash.
Okay.
This is the Narcan.
Right.
We do have Narcan in our vending machines.
Okay.
We also have fentanyl and xylazine strip test strips.
Right.
So what they would do is, if they want to test individuals who are using drugs, want to test their drugs.
Right. Okay. So I'm sorry, I don't mean to interrupt you. You've got a bag full of things that are available in the vending machine. I'm going to get some of this back to you.
So we have the Narcan, we have the Terra bags, the fentanyl strips, condoms, first aid kits.
Okay, let me ask you this thing. When someone comes up to the vending machine, how do they interact with it? Do they have to put in their name? Do they have to put in a phone number?
No, they just walk up to it. They'll see a plain screen, and it'll say go shopping. They hit the screen, and then the products will show up, because you can't just walk by and see what's in the machine.
Right.
They'll show up, and then you just dispense what you would like to have.
So if you needed a Terra bag, you ask for it, and that's what you get?
Yep.
Yeah. Now, Tony, you're a certified peer. Tell us what a peer does to help.
Okay, I'm somebody that had an addiction. I got into recovery, and now I help people get in recovery. But when people think of recovery, most of the time you think of drugs. You have several different other addictions that are involved. You have eating disorders, gambling addictions. So when you think of addiction, just don't think of drugs.
Right.
There's more to it. First off, congratulations on your recovery.
Thank you.
That's huge. Why is the lived it experience important as a peer?
With the community. Because when you're talking to somebody that's been there, had experience, they're not reading from a book.
Okay.
I can tell you things, you can talk to me, we know each other's terminology. So it works a lot better.
Makes sense.
You can share your story to connect with their story.
Well, you share a story not all the time with everybody. You share it when it's appropriate, because you don't want them to get fascinated with you, and you don't want to be fascinated with them, so you use it accordingly.
Yeah, and learning to advocate for yourself is just as important.
Right? Yeah.
Yes. We try to teach individuals that, when they come to see us, we try to teach them, we try to motivate them. We try to give them the skills that they need to be able to speak up for themselves and ask for help and, have a better life.
And I understand you're really wanting to make the point that peer support services, the vending machine, this is more than just drug addiction or drug problem.
Yes, because we have individuals, they might not have a drug problem, but they might not be able to take a bath.
Yeah.
They don't have the equipment to take a bath. So we also have personal hygiene kits, that comes with the soap and the lotion and combs and washcloths. So we have that. We're trying to get a better community, a healthier community. And we have resources available all throughout the community. If individuals are looking for substance abuse treatment, we do have 3 to 4 treatment facilities in Somerset County that will do mental health and substance abuse treatment.
The thing is, you've got to reach out.
Yes.
You've got to
Yes.
reach out.
And we
Yvonne,
have lots of resources.
Lots of-
resources.
Yvonne, Tony, thank you so much for what you do
Thank you
for
for
the
having us.
community, and thank you for talking to us today.
Thank you.